சார் அந்த சர்டிஃபிகேட் லிங்க் அமைச்சிருக்கீங்க. அதில் எதில் போடணும் சார்? நம்ம
யூடியூப்ல போடணுங்க. யூடியூப்ல உள்ள போனீங்க இல்லையா? யூடியூப்ல போடணும். இப்போ இல்லை, ஆரம்பிச்சது பிறகு மீட்டிங்.
சரிங்க சார்.
சாமுவேல் சார், ஹலோ 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 சாமுவேல் சார், இருக்கீங்களா? சரி, ரைட் ரைட், சரி சார்.
சார் வணக்கம்.
வணக்கம் சார், வணக்கம் சார்.
எப்படி
ஜாயின்
இருக்கீங்க?
பண்ணாங்களா உங்க கூட? நல்லா இருக்கேன் சார், நல்லா இருக்கேன் சார்.
ரொம்ப
டாக்டர் ஜாயின்
சந்தோஷம்.
பண்ணிட்டாங்களா?
ஏன் சார்?
டாக்டர் ஜாயின் பண்ணிட்டாங்களா?
ஒரு நிமிஷம் சார், கேட்கல சார்.
உங்க டாக்டர் மீட்டிங்ல ஜாயின் பண்ணிட்டாங்களா சார்?
வீட்டுல ஜாயின் பண்ணிட்டாங்க சார். யஷ்மிதா அருள்.
ஓகே ஓகே சார். Hello, everyone. Hello. Hello. Samuel sir. Samuel sir. Hello. Hello. Samuel sir. கேக்குதா? Okay, okay. Okay. Hello, everyone, and welcome to today's webinar. Dr. Kadamba, our institution our trust is managed by J. Karthi, educationist, philanthropist. Our trust for ways Institute of Technology, Science College, College of Nursing, School of Architecture, and also AMK Polytechnic. I would like to sincere thanks to our chairman to permit us to conduct the various webinars. Now he also give the permission to conduct the webinar series from our college. Our college offering B.Pharm and D.Pharmacy. I wish today Dr. Yarul, Annam University, me the link to in the question session. For those of you just joining with us, I welcome to all. Enjoy. Madam, you take care. Asmita, madam.
A warm.
Hello.
Yes, sir. Yes, sir. Thank you, sir. A warm good afternoon to one and all present here. First of all, I would like to thank Dr. Dharamal sir, the principal of this college, and also the management of Sri Sasta College of Pharmacy for giving me this wonderful opportunity. So I think without wasting time, I'll just share my PPT. So is my PPT visible, sir?
Not.
So is it visible, sir? Okay. So a warm good afternoon to one and all present here. I am Ashmita Arul, and today I'll be presenting on the topic Impacts of Sedentary Lifestyle and Sarcopenia in COVID-19. Now, for the past 2 years, COVID-19 pandemic has been wreaking havoc all over the world. The government has taken a number of measures to mitigate the spread, such as lockdowns, travel bans, quarantine, social distancing, and many more. Though these measures are highly effective in slowing down the spread of the virus, there is a minor setback that most of us don't realize. So, when we are confined to our homes, our physical activity decreases, we begin to implement a sedentary lifestyle and also end up triggering sarcopenia. So, first, what is sedentary lifestyle? When a person with little or no physical activity spends most of the time in the sitting, reclining, or lying down posture, he or she is said to lead a sedentary lifestyle. In such cases, the energy that is expended by the person is going to be less than 1.5 metabolic equivalents. Generally, a person is considered to be leading a physically active lifestyle when he takes more than 7,500 steps every day. When we come down to a range of 5,000 to 7,499, it is said to be a low active lifestyle. Here, This might look perfect, but it is certainly not suitable as it doesn't meet the general fixed recommendations. Further down, we have the category where people take less than 5,000 steps every day. Now, this is called as the sedentary lifestyle, and around 60% of the people around the world fall into this category. And thanks to the lockdown measures right now, more and more people are joining this category. So there are more people leading an extremely sedentary lifestyle. Generally, it is recommended that we must take 150 minutes of moderate intensity workout every week, as well as two muscle strengthening activities, either at the gym or at home. So, this is the general recommendation that one must follow in order to lead an active lifestyle. So, if I ask you all, are you active? I'm sure most of you would raise your hands and say, I am active. But are you really active? Have you ever questioned yourself? Here's an example which will test your theory. This is a man who goes about his normal daily routine. He wakes up, brushes his teeth, has breakfast, takes his vehicle, goes to the office, sits down, and spends around 5 to 6 hours in the same spot. Then in the evening, he might go shopping or hang out with his friends. And by night time, he can either prepare for the next day or just watch movies and listen to music. Do you think he is sweating? He might sweat due to the climate, but certainly not due to physical exertion. If he has an air conditioned office, then boom, he is happy and comfortable in his seat for long hours. So, this person, though he moves around a lot, he doesn't meet any of the recommendations of more than 7,500 steps nor 150 minutes of exercise, which means on the long run, he is leading an extremely sedentary lifestyle. Now, some people might say, I have a job where I need to move around a lot. I keep standing the whole time. For those of you who say, I am an engineer, a chef, a teacher, a person with a delivery service, a pharmacist, doctors, nurses, and any other paramedic, whatever your profession is, remember, the physical activity that is associated with your work is certainly not going to be sufficient to meet the amount of calories you consume. Therefore, occupational physical activity is not effective on the long run. This is because it doesn't, again, I'm repeating, it doesn't meet any of the recommendation, and of course, it is not going to help you reduce the risk of cardiovascular diseases or diabetes. Moving on, let us talk about what we do during this lockdown period. Most of us end up eating, sleeping, attending online classes, or working from home, and then just repeat the whole schedule. Some of us are even worse. We just enjoy our life. All we do is eat, sleep, binge watch movies and serials, scroll through Instagram, play online games, and just again repeat the whole set. What happens when our lifestyle is like this? We are going to see a decreased physical activity, increased electronic screen time, irregular sleep pattern, increased sedentary behavior, and of course, an increase in food intake. Simply put, the amount of energy that is intaken is going to be greater in huge amounts when compared to your energy expenditure. So, sedentary lifestyle has a number of negative impacts on your body, which will show long term complications. This is because it can impact your insulin sensitivity. So, when insulin sensitivity is affected, you can get type 2 diabetes. Everyone knows that India has a huge population of diabetic people and it is a rising concern. Now, sedentary lifestyle can also impact your cardiorespiratory fitness, leading to a number of heart related disorders such as angina pectoris, myocardial infarction, etc., at a very early age. You can get heart diseases even at the prime age of 40. Next, we can also develop an increase in visceral fat, leading to obesity, another major problem in India. and develop dyslipidemia. Now, dyslipidemia is a condition where there's going to be increased levels of cholesterol and triglycerides. Last, we have the disuse of muscle, which is going to trigger sarcopenia. And we must not forget that sedentary lifestyle can also increase the incidence of cancers, especially the breast and the colon cancers. Generally, people are commenting that sedentary lifestyle can also be called the sitting disease. This is because when you sit at the same place for more than 2 hours, you can have problems from your head to the toe. Some studies even suggest that sitting is as bad as smoking. Smoking 2 cigarettes a day is easily equal to 2 hours of sitting, that it has become that bad. So here this picture shows a number of problems associated with sitting, like poor posture, diabetes, colon cancer, heart disease, which I already mentioned. So let us talk in detail about muscle degeneration. Now, our body is made up of more than 600 muscles, and it makes up 40% of the total body weight. So muscles are very important for our everyday function. There are three main groups of muscles: the skeletal muscle, the cardiac muscle, and the smooth muscle. Now, what happens when these muscles begin to degenerate? We get a condition called sarcopenia. Sarcopenia literally means lack of flesh. It is an age associated decline in the muscle mass, strength, and quality that begins as early as 30 years. And it is also a major contributor to a number of health defects in older adults. Though it is an age related process, it can be accelerated to higher amounts by physical inactivity or prolonged bed rest. Here I have a CT scan of your thigh muscle. Okay, so this is going to be a healthy thigh muscle, whereas this is a sarcopenic muscle. Over here, we can realize that the white region over here will be the adipose tissue, and the darker region is the muscle, and inside you have the bone. When we compare it to the sarcopenic muscle, we can understand that the adipose tissue has increased and this muscle has shrunken down, which means this muscle is going to be weak because there's a reduction in the muscle mass and strength. So how does this all work? What is the mechanism behind sarcopenia? Now it is influenced by a number of factors. Let me talk about one of the major factors. Generally, there exists a very delicate balance between muscle protein synthesis and muscle protein breakdown. So, muscle protein synthesis is mainly due to the anabolic stimuli, which is promoted by factors such as muscle contraction during your everyday activity or exercise, hormones and growth factors, and of course, the protein that you add in your diet. On the opposite, we have the catabolic stimuli, which is responsible for muscle protein breakdown. Now, these catabolic stimuli is promoted by inactivity or lack of mobility, inflammatory or oxidative stress, and inadequate dietary protein, either due to malnutrition or obesity. Now, when the catabolic stimuli is increased in situations such as, let us take a person who is affected by COVID-19 and he is admitted to the hospital. Now, when you check this person, he is surely going to have a lot of inactivity because he is bedridden, and COVID-19 induces a number of inflammatory and oxidative stresses, and hospital food is not going to have all your essential dietary proteins. So all these factors are implemented over here, which means this person's catabolic stimuli is going to be greater than his anabolic stimuli. So there's going to be a tip in the balance, which means the muscle protein breakdown is going to be much more than the muscle protein synthesis. Or in other words, you can say that the catabolic stimuli has increased and an anabolic resistance has developed. Now, this is a main factor which contributes for sarcopenia. Moving on, here I've got a catabolic crisis model of sarcopenia. Now, as I already told you, sarcopenia is a gradual decline in the muscle mass. A person about 30 years can lose up to 3 to 8% of his muscle mass over a span of 10 years or a decade. But in this model, what happens is that the muscle mass or the rate of decline of the muscle mass is going to be accelerated because of increased periods of inactivity. Here you can see the increased dip in the muscle mass. So why does this happen? This is because the sarcopenia, that is the catabolic stimuli, is going to be increased because of increased physical inactivity and hospitalization. Recovery from this increased decrease in muscle mass is going to be very difficult, and also sometimes it may result in just an incomplete recovery. Now, things are becoming serious because young adults this is becoming serious because young adults who normally lead an active lifestyle by taking more than 7,500 steps a day are now just taking less than 5,000 steps. So when they do this, they are going to lose 5% of their muscle mass in just 2 weeks. Just imagine, during this lockdown period, most of us must have lost a lot of our muscle mass. Now, this is even more severe in older adults because they are more vulnerable to hospitalization and prolonged bed rest. Here, I've got a graph of a person who is admitted in the ICU. If you notice over here, there's a rapid decline in the muscle mass in just the initial stages itself, which means a person can lose up to 10% of their muscle mass in just 10 days. Now, that is very severe because generally a person loses only 3 to 8% of muscle mass over 10 years. But this person is losing 10% of his muscle mass within just 10 days. Just imagine how much he would lose if this rate continues. This is the reason why most of the people during their post recovery phase from any kind of diseases, they suffer a lot of muscle weakness, fatigue, and tiredness because they have lost a huge amount of their muscle mass within a very short span of time. That is the seriousness of getting admitted in hospitals and losing your muscle mass. So, here, let me talk about the relationship between muscle loss, COVID-19, and various chronic lifestyle conditions. Now, it is a very well established fact that COVID-19 is mainly affects the lungs. So, in severe cases of COVID-19, a phenomena called cytokine storm is observed. Now, the cytokine storm induces a number of inflammatory cytokines which damage the host's own tissue, leading to various symptoms such as your acute respiratory distress syndrome, multiple organ failure, and it can even lead to death. On the other side, there's a side effect, another side effect, that is, it contributes to sarcopenia by blunting the muscle protein synthesis. So, apart from damaging your lung tissues, it also triggers sarcopenia. Moving on, we have increased adiposity. So, when the fat starts accumulating within the muscles, it is called as an intramuscular adipose tissue. So, when the intramuscular adipose tissue increases, it is going to lead to an sarcopenic induced obesity. Now, obesity is a risk factor for severe COVID-19 infections. Next, we have the cardiovascular diseases. Remember, I told you about the three major muscle groups, of which cardiac muscles play a very important role. So, these cardiac muscles are responsible for the pumping action of the heart. So, when the muscle mass and the strength of these cardiac muscles reduces, what will it lead to? Certainly, it is going to increase the risk for a number of heart disorders such as your angina pectoris, atherosclerosis, hypertension, and many more. And cardiovascular diseases again is a risk factor for severe COVID-19 infections. Next, we have diabetes. The other major muscle group, the skeletal muscle. The skeletal muscle is responsible for up to 80% of the glucose uptake in our body. So, when the skeletal muscle mass decreases or when the physical activity is very less, then the amount of glucose uptake by these skeletal muscles is going to decrease to great levels. As a result, there will be an increased blood sugar level, which can easily lead to type 2 diabetes on the long run. And diabetes right now is one of the highest risk factors for severe COVID-19 infections and the black fungus or the mucormycosis infections. Next, we have the bone and the muscles. Bone and muscles share a very close relationship. The bones is responsible for the framework of our body, and the muscles are responsible for all the physical activity, both voluntary and involuntary. Now, let me quickly brief you about how a bone gets remodeled. There are two main cells, the osteoblastic cell and the osteoclastic cell. So, the osteoblastic cell is responsible for laying down new bone or bone buildup, whereas the osteoclast is responsible for breaking down the bone or bone resorption. Now, during increased physical inactivity or muscle contraction, decreased muscle contraction, and also during inflammatory or oxidatory stresses during infections such as your COVID-19 or your COPD, there's going to be an increase in osteoclastic activity when compared to the bone buildup. As a result, during overaging, you can easily develop osteoporosis and also increase the risk of fractures because your bones are going to get brittle over the age. So, in a nutshell, sedentary lifestyle can accelerate sarcopenia and also cause an increase in body fat, which is going to lead to a number of changes in the body composition, acting as predisposing factors for a number of chronic lifestyle changes such as diabetes, cardiovascular diseases, osteoporosis and frailty, cognitive decline, and depression. When a person with any one of these conditions is affected by COVID-19, then he is surely going to be admitted to the hospital and is going to undergo a long recovery process. Moving on, I just want to make sure that all of you are still listening, right? So sit up because here comes the important part. How to assess muscle strength and function. Now, doctors and physiotherapists all over the world use a number of tests to assess your muscle strength and function. So here are some popular ones. The first one is grip strength. For this, you need a dynamometer. Here is a dynamometer. So in this meter, it can measure the amount of force that you exert. It can be mainly used for all the muscles in the upper extremity strength and force that your muscles exert. The next test is the timed up and go test or the TUG test. In this test, all you need to do is sit in a chair, walk for 3 meters, turn around 180 degrees, come back, again turn 180 degrees and sit on the same position where you started. Now this whole process must be done within 20 seconds. If you are able to do it, then your muscles are flexible and have an endurance with balance. So moving on, we have another test over here called the heel rise test. All you need to do is lift up on your toes and drop back down. When you do this, we can check the efficacy of the calf muscles as well as the ankle flexors. Now, apart from being a test, it can also be done as a regular exercise because it has a very good effect on your leg muscles. Then comes the more popular test, the sit to stand test. All you need to do is sit in a chair, cross your arms so that you don't use it for support, and then stand up. Now, there are two variations of this test. One, you just sit up and down 5 times and measure how much time you took. It must be less than 15 seconds. Or else, set up a timer for 30 seconds, then sit up and stand down and see how many times you can repeat it within that stipulated amount of time. If you manage more than 70 repetitions, then you are good to go. Now, this might sound easy to all of you, but this is generally indicated for people who are of the older age group, that is above 60 years of age, or those people who are affected by some physical injury or accident. If you want challenging, go in for the sitting and the rising test. In this test, you throw away your chair. All you need to do is go down to the floor and stand right up. When you do this, you will be assessed on a scale of 10. Every time you use your hand or your knee or your forearm or thigh or even the side of your leg, you will lose a point. So, those people who manage a 9 on 10, give yourself a clap because your leg muscles are really very strong. Repeat it as many times as possible, and if you're able to do it, then fine. Very good. So that is enough with the tests. Let's see how we can prevent sarcopenia. For this, you need just two main things: nutrition and exercise. First, let's talk about exercise. Early controlled muscle mobilization and muscle strengthening is going to be important for people of all age groups, especially the older adults, because they can help to counteract the impact on the neuromotor system and physical function. If you have a habit of going to the gym, excellent, because your muscles can be kept very well in shape using all the gym equipments. My advice is that don't overload your exercises. Make sure you start small, repeat your circuits, and then slowly progress to higher levels. You can also go in for planks and push-ups because it activates your entire core, and it can easily be done at home too. If gym is not your piece of cake, then go in for aerobics or Zumba because they keep you on your toes and make you feel very active and also end up stretching all the muscles in the body. Some people insist on resistance training. Now, more than weightlifting, resistance training also plays a very important role in improving your muscle strength and tone. All you need to do is get a pair of resistance bands. Now, these bands are made up of elastic and rubber, and it will exert a force on your muscles when you move around with it. Here you can see this man doing a simple squat movement with the help of a resistance band. So when you do it normally, you won't have the resistance, but when you do it with a resistance band, it is going to exert a force against the movement of your muscles. Thereby, it is going to improve the tone of your muscles. Now, these resistance bands are available in a number of colors. That is, these colors are going to indicate the strength of the elasticity. So, depending upon your level of fitness, you can choose from lightest to the heaviest resistance band. And of course, we have to mention yoga because yoga is the ultimate guide, and it can surely keep your muscles flexible and also maintain the tone of your muscles. Some important asanas such as Dhanurasana for your back, Tadasana for your thighs, Chakrasana for your abdominal muscles, and many more. Every asana in yoga will help to stimulate your muscles. And the Surya Namaskar, which comprises of 12 asanas, again is a perfect way to build up your heartbeat and also improve the flexibility and strength of your muscles. Doing Surya Namaskar every day has been reported to give excellent results in people of all age groups. Now, if you think yoga, gym, aerobic, or Zumba is too overwhelming for you, all you need to do is put on your shoes and go for a walk. Walking is extremely beneficial to all age groups. You need not say that walking is just meant for old people. Of course not. Walking is a benefit to people of all age groups. Studies have reported that when you walk more, your immune system improves, your muscle strength improves, and you can also maintain your weight. Walking will increase the number of steps you take, and if it is going to be more than 7,500, it will put you right in the physically active lifestyle. So you need not go to the gyms, just go for a walk. Now let's talk about what we must eat. Of course, proteins are the major concentrate over here. Proteins are the body building blocks of muscles. Now, you may not go to the gyms and eat meals where you might have your non-veg or something. Never do that. Evenly separate the proteins among all the three meals: breakfast, lunch, and dinner. The WHO's recommendation is that we take 0.8 grams of protein per kg per day, and this is applicable for all individuals. But you must note that this recommendation is only to prevent you from becoming protein deficient. Now, if you are leading a sedentary lifestyle or your physical inactivity is low, then you can go up to 1.2 to 1.6 grams of protein per kilogram of your body weight every day. Now, this is also indicated for people who build their muscles in the gyms, wrestlers, sports people, and all the other physically active people too. zero point 0.8 grams is the bare minimum, and you can extend amino acids. One such amino acid is leucine, and leucine is very important and it must be included as a part of your protein intake because it maximally stimulates your muscle protein synthesis even in sarcopenic individuals. A number of reports have come saying that among all the other amino acids, leucine has had greater efficacy and potential to stimulate the muscle protein synthesis and build up. Now you can find leucine in all the fish, milk and dairy products, eggs, and red meat, chicken, and many other things you might be knowing. If you are a vegetarian, you can substitute with legumes, kidney beans, chickpeas, soy milk, oats, and etc. etc. Some people even go in for protein powders such as whey protein. Now that is also recommended, but always go in for a checkup before you take up powdered proteins. Now, apart from proteins, you need to do vitamin D supplements because of our reduced exposure to the sunlight. 1,000 to 4,000 international units per day is going to be sufficient. And you can also take an omega-3 supplementation. Now, omega-3 is again a marine product which you can get from fish. Vegetarians can take it from the capsules which is available completely with no side effects. So omega-3 supplementation is very important because it has excellent anti-inflammatory properties, which is certainly going to protect you from serious COVID-19 infections. Overall, make sure you reduce your calorie intake and concentrate more on proteins and fibers, which you can get easily from fruits and vegetables. Now comes the question most of the people might be asking, is too much protein going to harm my body? Medias, relatives, information, everything that you might have heard would say that your kidney and liver will get affected. Yes, they will get affected, but there is an extent to which you can take protein. That is, there has been studies that have checked the levels of protein. So a person with taking 4.4 grams of protein per kilogram of body weight every day is still has no complications provided he is a healthy individual. Now this 4.4 grams is actually 4 times what is normally recommended and still no complications were observed. But more than this, I don't think it is recommended. Now let us talk about those people with chronic kidney disease or liver diseases. Now for these people, the doctors will recommend you to have a protein restricted diet. Now why is that so? They do it so that you don't aggravate the kidney diseases or liver diseases by increasing the protein content. So what can you do then? When your protein content is low, it is surely going to increase your capability or increase your chances for sarcopenia. In such cases, you must always go in for some resistance training. Resistance training, along with a restricted protein diet, is okay so that we don't suffer from the serious consequences of sarcopenia. Next, I'm sure most of you would know who this is. This is Thanos, the villain, and his last words were, "I am inevitable." Our presentation today, the villain is going to be sarcopenia. So, is sarcopenia inevitable? What do you think is the answer? It is certainly no. Sarcopenia is not inevitable. For example, let us take your skin. When you're young, your skin is going to be soft and supple. But as you age, it is going to become firm with a number of wrinkles. So, it is called as aging beautifully. So, when you can age beautifully, I'm sure you can age gracefully. Isn't it? So, in order to age gracefully, all you need to do is work right now so that your muscles will not undergo a loss of muscle mass and strength over the ages. Instead, you can retain some of your strength so that you can stand on your legs independently until the very end. Now, here we have the example of Nilammal, and she is the latest recipient of the Padma Shri Award for her contributions in yoga field. Now she is 99 years old and still she is able to do all the difficult asanas that most of us over here wouldn't be able to do, which means she has retained her muscle flexibility even now, only because she has practiced yoga from the age 8 and now she is still practicing yoga. So she is a very an inspiration for us because we most of us are not even active at this age itself. Thus, for an active lifestyle, all you need to do is remember the shape of the number 4. Sleep adequately. You need to take at least 6 to 8 hours of continuous sleep. Make it a motto that you go early to bed and rise early. Next, sit as much less as possible. Take more number of steps. Increase the count to more than 7,500. Keep walking. And also do exercises that make you sweat for at least 150 minutes every week. One of the main barriers that prevents you from becoming an active person or from leading an active lifestyle is your mindset. When you believe that work is very important and exercising is a waste of time, or if you think I'm too busy and I can't even squeeze in a 30-minute workout session into my schedule, then your mindset is wrong and has to be changed. So just start small. All you need to do is track the time you spend sitting and reduce it as you go on with days. Take regular breaks every 30 minutes if you are in a sitting job or when you work at home. When you get up every 30 minutes, you can help in the circulation of blood to your legs. Next, make sure you go for a small walk just around the house after lunch so that you can fight the drowsiness and which will tend to make you sleep for long lazy naps in the afternoon. You need to avoid these naps so that you can take a proper sleep at night. Then you also have to make it a habit to take the stairs. Avoid elevators or escalators at any cost. Eat less and drink more water. And again, make sure you exercise for at least 30 minutes every day. Thus, I like to conclude by saying that sarcopenia and sedentary lifestyle has numerous negative impacts on your body and it leads to a number of long-term complications. So, it must be rectified as soon as possible. Right now, physical inactivity and sarcopenia are considered as risk factors for COVID-19, surpassed just by age and history of organ transplant. Such is the seriousness of sarcopenia. Therefore, people who lead a sedentary lifestyle and has a weaker muscle strength are more vulnerable to COVID-19 hospitalization. Don't use this lockdown period to become lazy. Instead, find ways to become more and more active. Reduce your calorie intake, concentrate on adequate protein and fibers. And of course, this presentation cannot end with the saying, stay home, stay safe. But you need to add more to it. Make sure you move more, sit less, so that you can have a better quality of life as well as fight COVID 19 more actively from the safety of your homes. Thus, with my favorite ending, I would like to end this presentation saying that the future depends on what you do today by Mahatma Gandhi. Thank you.
Thank you, madam.
Thank you, sir.
Anybody having any questions, please chat box. Viewers, anybody having doubts, anybody having asked questions, you give the question in the chat box.
I once again would like to thank the principal, Dr. Dhanapal sir, and the management of Sri Sasta College of Pharmacy for giving me this wonderful opportunity. And I also thank all of you for your kind attention. Thank you. And any
Thank you,
doubts?
madam. Madam, one question.
Yes, sir.
Why we should not climb in steps? Somebody say Hemalata asked for this.
So we should climb steps. I don't understand her question because now we must take the stairs as much as we can. And
Climb in steps.
yes, sir. Unless she has arthritis or any other knee related problems, taking the stairs is the best option. We must take the stairs as much as possible. Okay.
Okay. Anybody having doubts? Anybody having questions? Anybody having questions? Please chat. Okay, no questions. Now we no question from any YouTube viewers. You wrote question from the Google Meet. Now we finish the section. Vote of thanks by Dr. Fatima Grace in our college.
Good evening, one and all. I am Dr. Fatima, Associate Professor, Department of Pharmaceutics, Sri Sasta Pharmacy College. With immense pleasure, I would like to present the vote of thanks for this webinar. First of all, I would like to thank the Almighty for making today's event a resounding success. With His blessings and grace, we are able to make this event what it was and to keep us all safe and healthy. Next, I would like to thank our chairman, Professor J. Karthikeyan, the torchbearer of this event, for leading and inspiring us in working towards the goal of conducting this webinar. We are thankful for him to his huge support at all times. No event can take shape without a hard-working leader. I would like to extend my sincere thanks to our beloved principal, Dr. V.DANIEL, for his dedication, enthusiasm, and efforts in conducting this webinar. On behalf of the organizing team, I would like to extend my heartfelt thanks to the speaker, Ms. Yashmita Arul, dental surgeon, Annamalai University, for her commendable and inspirational talk over the topic, impacts of sedentary lifestyle and sarcopenia and COVID-19, which is the need of the hour. Thank you, ma'am. I would like to thank Dr. Arul Kumaran, her father, for the same. Next, I would like to express my humble thanks to all the faculty, students of Sri Sasta Pharmacy College for their support and cooperation. Our sincere thanks to Dr. Samuel Taumani for rendering his timely help. I'd like to thank all the participants from various colleges for making this webinar a success. Once again, I thank one and all for your valuable presence. I apologize if I have missed anyone. Thank you, one and all.
Thank you, ma'am. Thank you all. You collect your certificate. Already sent this link in the chat box. Both YouTube as well as the Google Meet chat box. we send the link. You collect your certificate from this link. Thank you, one and all.